Our next speaker is Dr. Michael Mack, who will discuss clinical studies, clinical results with surgical studies for appendage occlusion.
Great, thank you very much. So this will be a very short talk, so we'll have time for panel discussion. I did bring up the program agenda here, and the session's entitled Clinical Trials in Left Atrial Appendage Ligation, Protect AF, Place 2, Amplatzer, Amulet Plug Study, and Surgery Study. Generic surgery study. What does that mean? That means that there is not a whole lot going on in the surgery space here, but I'll kind of review what is going on. If you go to clinicaltrials.gov and search for left atrial appendage studies, there are 42 studies. Most of those are either completed or terminated. There are some active ones, and you've heard about the active ones in the catheter-based arena. And the ones that are active in the surgical arena are the group of LAOS studies, which stands for Left Atrial Appendage Occlusion Study, and 1, 2, and 3 that I'll talk about. A cardiothoracic surgery network AFib trial, which isn't left atrial appendage per se, but it's an integral part of the trial, and a Danish study called the FAST-2 study. One of the studies that's closed was Medtronic's version of the AtriClip device, which was an occlusion device that would go on from the epicardium and cinch around the base of it. Concept similar to Lariat, but with rather than a suture, with a polyester-coated band. This trial was stopped very early on in the enrollment for difficulty enrolling into the trial, and this was not finished, and there will be no results coming from that. If we look at the LAOS studies, the first is LAOS 1, and this was published in the American Heart Journal in 2005. And it was 77 patients randomized to left atrial appendage occlusion, either suture or staple. 52 it was 52 was suture or staple, and 25 were control. There was 2-to-1 randomization. 20% had appendage tears requiring a suture repair intraoperatively. TEE was used to assess closure intra-op and at 8 weeks post-op, and failure was defined as Doppler flow across the occlusion or a residual stump of greater than 1 centimeter. And you can see that using suture occlusion, only 45% was successful, and using stapler occlusion, only 72% was successful, and the main reason being this residual stump left of greater than 1 centimeter. And there were 2 peri-procedural events. So you can see that even with this, having this appendage right out in front of you and total control of surgery, that the results are not what you would expect it. And I think, as you heard from Greg and myself talking this morning, and Rich, that it's not as easy as you would think. It's a very friable appendage. There can be a lot of problems that happen with it. Now, I thank Rich for these slides that he gave me during the break here about the LAOS 2 study, which has just been completed. It is a pilot study for the LAOS 3 study that he mentioned this morning, and I'll talk about in just a minute. So the LAOS 2 study was a 51-patient feasibility pilot study with an occlusion arm and a medical arm. The occlusion arm was staple occlusion or cut and sew while the patient was cannulated, and all patients were treated with postoperative aspirin. The medical arm was no occlusion and optimal antithrombotic therapy as per current best evidence. The objectives of the trial were to determine the feasibility of recruiting patients in a timely manner as a setup to LAOS 3, to demonstrate the efficacy of the cut and sew technique and whether it really could do better in terms of actual success rate than we saw in the first LAOS study, report the rate of compliance with allocation to demonstrate the safety of appendage occlusion through the need for postoperative re-exploration for bleeding and the rate of reoperation related to bleeding from the left atrium. And then fifth, to collect preliminary event data on stroke and non-central nervous system systemic embolization. And these were the results of that trial. So of 1,889 patients screened, 10% or 204 had a history of had atrial fibrillation or a history of atrial fibrillation. There were 26 in the occlusion arm and 25 in the no occlusion arm. The endpoint of death, MI, stroke, or non-CMS embolization or major bleeding occurred in 15% of the occlusion arm and 20% of the non-occlusion arm. There were 2 deaths in the occlusion arm and 3 in the non-occlusion arm. And the stroke were interesting. There was 1 stroke in the occlusion arm, and it was perioperatively. There were 3 in the non-occlusion arm, and they were out of the perioperative period up to a year afterwards. So on the basis of this, the LAOS 3 study was designed, and it's left atrial appendage closure using suture and or a surgical excision, which is what's being recommended, versus no intervention on the left atrial appendage. It's a 4,700 patient study. They're in, and the trial has started. I believe Richard said this morning there have been 63 patients enrolled in this study at the current time. The primary endpoint is stroke or systemic arterial embolization at a median follow-up of 4 years, which means the estimation completion date is 2019. Everybody will be hopefully enrolled before that. I think this is a absolutely critical, pivotal study that everybody in the room should be interested in, because it'll tell, hopefully for once and for all, whether left atrial appendage occlusion is effective at preventing stroke or not. If this trial is positive from that standpoint, that carries huge implications for all of the device studies that are going on. And this is a trial that's powered for a clinically significant endpoint. So I see this as a pivotal study that will shed a lot of light that we really haven't learned after 60 years of doing this in surgery. And I'm so enthused about it, I signed up with Rich as a site this morning. So hopefully we can start Monday. Now, there are 2 other studies to briefly talk about. First is the CTSN trial. So this is NIH-sponsored trials of 20 centers in the United States that are asking limited questions in surgery questions that can be answered in a 5-year period of time with a limited number of patients. And this study is in patients undergoing mitral valve surgery, and all patients get left atrial appendage ligation or excision. The second group of patients, in addition to that, get bilateral pulmonary vein isolation. These are all patients have atrial fibrillation. And the third gets, as well as left atrial appendage ligation and excision, a full left and right-sided Cox-Maze procedure. This study size is 260 patients. As of this week, 240 patients have been enrolled, so we're hoping to complete this study sometime in early April. The primary outcome is freedom from atrial fibrillation at 12 months, and there's a number of secondary outcomes here. There is no control arm that does not have left atrial appendage ligation in it, so we're going to get limited information on the left atrial appendage aspect to the study. And then the last study to talk about is the FAST-2 study. And this is a Danish study in which patients get randomized between the minimally invasive mini-maze procedure, so they get thoracoscopic bilateral pulmonary vein isolation and left atrial excision or exclusion at the time, compared to catheter-based RF ablation. The primary endpoint is freedom from atrial fibrillation with or without an antiarrhythmic drug at 12 months. There's a number of secondary outcomes here. The estimated total enrollment is 180. It started in April 2011 and should complete enrollment later this year. Again, this does not directly address the issue of left atrial appendage, except for the fact that the surgical arm will get it and the catheter-based arm won't. So hopefully there'll be secondary information that comes out of it. Thank you very much.
Thank you.